Hi, I'm Julia Supa. Do you suffer from persistent or chronic neck and back pain? It could be your poor posture to blame. We're chatting all about spine care, neck and back care, and I'm happy to welcome Dr. Matthew Missiha, chiropractor and acupuncture provider to In the Know. Welcome to In the Know.
Great, thank you.
You're a first timer, so we're glad to have you.
I'm very excited to be here.
All right, so chiropractic care. Why is chiropractic care good for everyone?
So chiropractic care is good for everybody because it is a safe form of manual therapy, and what chiropractors can treat is a whole variety of muscle, joint, ligament, neurological complaints that people may experience. Some of the complaints include neck, low back pain, headaches, but then as of lately it started to expand into other forms of healthcare and other forms of conditions, including shoulder pain, knee pain, hip pain, arthritic conditions, ankle injuries, etc.
Okay, and so you brought your buddy the spine in here, and it's
Take him everywhere.
Yeah, it takes me back to when I was a kid. You know, like every single bone, the head bone is connected to the neck bone, and you know all of these bones and muscles are intertwined. And while you might feel a pain here, it might actually have to do with something over here.
Absolutely. And a lot of people feel that you have to treat the site of the pain. Meanwhile, just because the pain hurts there, that doesn't mean that that location is actually causing the pain. So exactly what you said, if you have a shoulder injury, sometimes it could be coming from the neck and how the body moves.
And why is why is this happening? Is it because of, you know, too much texting, too much computer, too much driving?
Exactly what you said. A lot of people think that just because they hurt themselves on that event, whether they say like a slip and fall, that's the reason for their pain. Now, that's a form of trauma, so absolutely a slip and fall can be the case. Mm-hmm. But what you said with, you know, constant driving, constant sitting, constant texting, all those can attribute to the neck, low back pain, headaches, and any form of complaint that people may experience because it is something that they do every day and they do it for many hours in the day.
So at what point should someone come and see a chiropractor? What point should people come and see you?
It always depends what the patient is looking for, and it also depends the severity of the complaint. I've had patients come see me right away, and then I've had patients wait months and months and months. At the end of the day, the sooner you get it looked at, the easier it is to treat. And I always tell all my patients that if the complaint ever rises again, to come see me sooner rather than later. But pain always fluctuates. Some people may feel better on its own. Other people feel better after receiving chiropractic care. The sooner you get it treated, the better the response time will be.
Okay, and then how long is the chiropractic care journey? Is it something that once you start, you don't stop?
And that's another myth, but to be honest, it all depends what the patient is looking for, and it depends the condition. There's some individuals who come see me and the complaints that they have last for several years, and they're finally coming to see me. So of course, the treatment plan for them is going to be a lot longer. Usually the amount of time that the patient has the complaint, that's the amount of time that will reflect how long their treatment plan is going to be. If you just came to see a chiropractor right away after getting the treatment, after finally having the symptoms exactly, then the treatment plan would be a lot shorter. If this was something that you're living for longer periods of time, then treatment is going to take longer, but it really all depends what type of treatment is being provided, what is the patient looking for, and what is the patient doing outside of the clinic space.
Okay, and we're going to touch on some of those myths later on in the show, but so anyone, any age, can come see a chiropractor? Any
age. There's always the elder population that comes to see chiropractors. As of last week, I had an infant come see me because the parent was overly concerned with a particular condition. Really any age, because chiropractic is a safe procedure for any age, and there's a lot of different treatment protocols that chiropractors can use. It's not just adjusting the back, but there's a lot of joint mobilizations, muscle release work, acupuncture, rehabilitation, exercise, and more so education.
Okay, so yeah, let's talk about this education and rehab because you have to take care of the spine that you have, right?
Exactly.
It's holding your whole body together.
If you don't take care of it, there's going to be a lot of problems down the road. The same way that you look after your car, the same way that you look after your own personal health, you got to look after your spine as well.
So posture.
Posture. That's a big thing that everybody talks about, but a lot of people tend to ignore that. we're so used to being in a day and age where all we're doing is sitting like this, and then we're constantly having our neck crump forward. Now, that is going to lead to a lot of problems down the road. And, you know, being in that poor posture is going to develop a lot of neck pain, but also low back pain because you're sitting for long periods of time.
So take a look at what you're normally doing. I remember from when I was a little girl and I used to dance and do ballet, and my mom would always say, stand up tall with your shoulders back. And
they're right for something,
oh my
right?
goodness. And I probably did when I was little, and then as you know, as you've gotten older, it's like you're
exactly, and the sooner,
going into this body.
And that's exactly it. When you're mindful of your posture, it makes it so much easier for you to respond to other conditions. So when people ignore their posture or they ignore their health, it's going to lead to a lot of negative effects down the road. The sooner you think about your posture, and the sooner you think about your complaint and the care that it needs that can be provided from chiropractors or other forms of healthcare providers, the better you will respond, and the better that you could return to your activities of daily living and not experience the pain you do when you're at work or when you're at home or when you're trying to do simple tasks around the house as well.
So does it all stem from the posture?
A big chunk of it, absolutely.
So
absolutely.
We're going to do exercises later on, so I don't want to ruin it, but how do you fix your posture? Is it something that when you're, you know, 30 plus, it's like, all right, you're done?
You know what? Posture can be fixed at any time, any age. A lot of people feel that, oh, I'm too old, my posture, this is something that I got to live with. Absolutely not. There's some people from the elder category that they have come see me, they want to fix their posture, and they're able to walk for longer periods of time. They're able to spend time with their significant other. And then there's other people closer to, you know, mid-30s or even late 20s. They always get the neck pain and low back pain that they have because they're sitting for long periods of time, because they're always texting on their phones, and because they're always developing that neck tension. Always keep in mind of your posture, and you can use many forms of therapy to help improve your posture, whether it's exercise, whether it's joint mobilizations, muscle release therapy, but more so education. When you understand, you respond that much better.
Okay, we have to take a short break. When we come back, we're going to talk about some common chiropractic myths. So you don't want to miss it because we've got some good ones. Don't go anywhere. Welcome back to In the Know. We're talking all about neck and back care, spine care with Dr. Matthew Missiha. Welcome back. So, common myths. I mean, chiropractic is something that it's an alternative medicine or alternative therapy.
Correct.
Some people are terrified of chiropractors.
Yeah.
How could you be scary? I'm not.
I ask my
part
patients
of that,
all the time.
Yeah.
But it's definitely something that goes around that chiropractors are scary or chiropractors cause more harm than good. That all comes down to lack of education. When you understand what a chiropractor can do and how that can help you, and you take these common misconceptions and ask your chiropractor about it, and they provide you a good response. So a lot of people they don't understand what a chiropractor can do and how a chiropractor can help them. But once you actually see the chiropractor and you take the time to talk to them, explain to them your goals, explain to them what you want done from treatment and how they can help you, it makes the world of a difference in terms of how you respond.
Okay. So let's go through some of these myths. I love debunking myths. So you mentioned in the first segment, safety, and chiropractic care is safe.
Yes, absolutely. There's always going to be risks involved with treatments such as aggravating pre-existing injuries. However, there's a lot of research that does support chiropractic care and how safe it is. There's also a lot of form of treatment that chiropractors can do aside from just bone cracking, and that comes from muscle release therapy, that comes from exercises, that comes from postural education. These are all safe procedures that chiropractors can use to help their patient. And like anything else, there's always going to be risks with anything, but chiropractic care is definitely safe for all ages.
And so I've seen a variety of different chiropractors in my life, and at the beginning when I was younger, it was a lot of cracking and manipulation, but I think chiropractic education as well has changed.
Very
so, you know,
much.
I might now get a soft tissue massage or acupuncture therapy, which you also perform.
Absolutely, and that was exactly how you said it. It used to be the old analogy that chiropractors just crack backs. Meanwhile, there's a whole lot of other therapies that we use to help patients, and it all depends, what the patient's looking for, and it also depends the condition that the patient is experiencing. In my time, I don't even adjust 50% of my patients, and all my patient success comes from two things: rehabilitation and education. Rehabilitation, we always know that exercise is important for the health and for the human body, but education is when you could take the time to explain to the patient what makes sense, and they get it, and they're able to take what you teach them and apply to their everyday lives. That's how they respond better. And treatment duration is a lot shorter than something that people expect to be very much long-term.
That's a good tip. So talk to the person who's performing the chiropractic care or the acupuncture therapy on you, and you're going to learn so much.
And never be afraid to ask questions. There's no such thing as a stupid question.
Okay, all right, you're going to learn a lot. Do chiropractors treat more than back pain? Of course.
Back pain, neck pain, and headaches are the three most common ones, but with the expanding scope of chiropractic care, I see a lot of shoulder injuries, I see a lot of hip injuries, and I see a lot of knee injuries. And a lot of these injuries can develop from running, a lot of these injuries can develop from poor posture, like we said, and a lot of these injuries can happen from trauma. So there's a whole lot of injuries that chiropractors can treat. Anything involving the muscle, the joint, or any form of neurological complaints, so the nerves, and sometimes people get numbness and tingling into the hands. Talk to your chiropractor about it. They can offer various forms of treatment to help with that.
Okay, all right. What is the difference between a chiropractor and a physiotherapist?
To be honest, there's not a big difference. I always tell my patients that back in the day, chiropractors were very much focused on adjusting the back, and then physios were very much focused on rehab. Now that's very much changing. You see a lot of chiropractors that can do the same thing that physios do with muscle release work and with a lot of exercise treatment, but then there's a lot of physios that do a lot of joint mobilization and joint play that chiropractors do. The perfect analogy I have for my patients is think of a chiropractor as a Ford and think of a physio as a Chevrolet. One of the things is there's different features with each car. However, they're both designed to get you from point A to point B. Find someone that you like, find someone that is very sociable, find someone that can answer the questions that you have and who believes in the same goals that you do. And
in a lot of clinics, you'll find that physiotherapists and chiropractors work simultaneously or in the same office.
Absolutely, and it leads to better patient results. It leads to more informative decisions from both the patient as well as any other health provider there, and it makes for a good team environment.
Okay, I love this one. What is that popping sound, and can I develop arthritis from cracking my own joints?
So that popping sound that people hear, it is not bones cracking. So if you take a look at the spine, there is a space in between two bones. If two bones aren't moving the way they should, what happens then with an adjustment, it helps increase the space in between, and it's just air rushing into the joint to help it move better. Now, can you develop arthritis from there? So far, they haven't found any research that bone cracking leads to more arthritis, and you're just as likely to get arthritis with doing everyday activities, because arthritis is pretty much wear and tear on the joints, and that comes with age, and that comes over time. It cannot be sped up with chiropractic care. And really the big thing that I always like to educate my patients is if you were to break a bone, you would know and you would be in the hospital rather than seeing a chiropractor.
Okay, so it's not different kind of cracking there. Okay, here we go. This one says, only if I want to ask this question. Do chiropractors cause stroke? I've never even heard of this one.
Chiropractors do not cause stroke. You hear in the news and you hear in the media about chiropractors being linked to strokes. However, what people need to understand is that there is an association. An association does not mean a causation. The same way that people who smoke, that doesn't mean that they're going to develop cancer. So the reason why chiropractors are very much known for causing strokes is not only because people are very misinformed, but because chiropractors are at the forefront of seeing neck pain. It is the second most common condition that people treat, and a lot of times with neck pain and people coming in to see a chiropractor, people often forget that the signs and symptoms of a stroke in the early stages is very much the same idea as to a regular neck example, and it just so happens that it could be missed from not only the chiropractor but other health professionals. So chiropractors do not cause stroke. It's just something that is not just missed, but something that is mimicked in different signs and symptoms that the patient may experience.
Okay, we have to take a short break. Thank you for that, and thank you for all those debunking myths. We have to take a short break. When we come back, some exercises to help with your spine and your posture, and some at-home tips and tricks. We'll be right back. Welcome back to In the Know. We're talking all about neck and back care and spine care with Dr. Matt Missiha. So exercises, we know it's important, but we're not talking about going to the gym. We know that's important too. But exercises that we can do, anyone can do at home, at work even, to kind of help
Improve their posture.
improve our posture as we sit up here very tall.
I always incorporate exercises with all my patient treatment plans. And all these exercises, what they have in common is that you don't need to go to a gym and do them. You could do them at work. You could do them at home. Some of these exercises you can even do in your car. And I always come up with 4 of them, at least in the beginning. And then as we build the foundation, then we can continue to progress with that patient's plan.
Okay, so belly breathing. How is belly breathing an exercise?
So
All right.
one of the things that people forget about the abdominal core is that there's a lot of musculature around it, and strengthening your core is going to help prevent low back pain down the road.
Right.
So belly breathing, what I like to tell my patients is imagine that there's a balloon in your belly and you're working on expanding it. Then once you figure out how to expand it, then you got to work on contracting the belly so that the belly button is going back into the spine. Then once you're able to do that comfortably, then you got to time your breath so that as you breathe in, the belly goes forward. So, and then as you breathe out,
It's almost like reversing.
exactly. So the idea is you're not breathing through the chest, because a lot of us are chest breathers and then we forget all about strengthening the low back musculature, but focus on expanding the belly as you're breathing in so that air rushes in and really helps to stiffen the spinal area so that it prevents you from developing low back pain down the road, such as when you're bending to pick up something or sitting for long periods of time.
That's hard.
It's
That you
challenging.
really have to kind of wrap your head around.
Yeah, I always get my patients to do it lying down first, but if you're, say, in the office space, what you want to do is focus on expanding the belly as you're seating, and then you want to contract the belly,
back in.
but you have to time the breaths correctly with it.
So when you're breathing, when you're contracting, you're exhaling.
Exactly, so
And when
air is
you're-
rushing out.
Okay.
Yeah.
All right, so it's like you're filling up a balloon and deflating it.
Exactly.
Okay.
And that helps strengthen the deep muscles in between the spine so that they learn how to activate when you need them to activate.
Okay. Chin tucks.
Chin tucks is a great one for neck and shoulder pain. What I always like to tell my patients is you could do this while you're driving. For every red light that you go to, you want to do 5 of these. And the idea is you want to take your chin, put your finger on your chin, and then instead of bending it down, you want to bring your chin backwards to the back of your head so that you're tucking it in. And the idea is you want to be stretching out the back here and contracting the front, and then you want to bring your chin forward. Exactly. So it's not bending down, it's coming backwards.
Oh, so you're just like a puppet.
Exactly. And then bending it forward. That's exactly it. And the idea
Okay.
is you're strengthening the muscles in the back of the neck. And more so, you're preventing yourself from always being in that constant position with your neck extended that way. And then you're helping to bring it forward.
Because people over time have, like our spines have kind of done this, right?
Well, that's
When we're
exactly it.
leaning.
Like when you're texting, you're always bending forward, so you want to prevent that motion. And so that's why you work on bringing your chin back.
Okay, next one. Thoracic flexion.
That's actually my favorite exercises.
Okay.
So I always like to tell my patients that you want to imagine that your spine is going one by one by one, all the way to the top of your head into your elbows. So start by taking your hands, and you want to bring them behind you.
Tight dress, okay.
Exactly. So the idea is you want to bring your elbows in first all the way, and then you want to start by bringing your chin down, and then start rounding your mid-back just a little bit, and just stop right there. Then you want to go back one by one. So start with the mid-back coming up, right? And then you want to start with the head, look up, and then open with the elbows.
All right, that feels good.
Right there.
And so that's to open up your chest.
That's to help open up the chest and really help decrease a lot of stiffness that's happening in the mid-back region there.
Ooh, that's what I need to do. Okay. And the last one, seated wall angels, and we're going to do it seated, but not with a wall. So you can do this with a wall as well.
You could do it on the wall. You could even do it on the floor. But I like to use this exercise with my patients. I'll actually demonstrate it on you. And if I have you come to the side, and you could face that way so that the viewers can see how we want to keep the neck and the mid-back in neutral.
I will do my best.
So take the band and you want to bring it over your head. And then you want to stretch your arms out just a little bit like that. Perfect. So one thing that we always want to make sure is that the neck and that the mid-back are in line. And then you just want to take your hands and then you want to bring them behind your head like that.
Ooh.
And then you want to bring it up like that.
All right. And how many times do you do this? How many reps?
So you want to do this at least a couple times every hour. I always challenge my patients if they could do 4 to 5 of them every hour. So the idea is it's kind of like the thoracic flexion where you're opening up the mid-back region and you're focusing on strengthening the muscles in the back here while keeping the neck muscles intact with the rest of the mid-back body.
Very cool. All right. I felt that. That felt good. Okay, so and very quickly, we talked in the break, or we were joking about, you know, everyday activities and what you have. And even something like your pillow can make a difference on your neck. Like I said, my pillow is done. It's shot. I need a new pillow.
Everybody always asks me, you know, what kind of pillow do I need? At the end of the day, it all depends what you're used to and what is most comfortable for you. Personally, I like to use a firm pillow because that prevents my neck from ending up in a position, because a soft pillow, it tends to compress, versus a more firm pillow, your neck and your head are more likely to stay in the exact same position. It's not gonna tilt this way as the pillow starts to deflate while you're sleeping. Rather, with a firm pillow, you're more likely to keep your head there.
And what about like those chiropractic pillows that kind of look like that?
You know what, those are also good too. I haven't heard anything bad about them. I've heard some patients say that they really like them. I've had some patients say that it hasn't really done much. Ultimately, at the end of the day, it's what is your body used to? Some people, you know, like I said, they prefer the firm pillow, they prefer the soft pillows. Those chiropractic pillows, they are good. It's always worth giving it a shot. If it works for you, great. If not, then we could always try another form of care.
Awesome. Thank you so much. We've reached
pleasure.
the end of our show. Thanks for being a great guest, and I want to thank everyone at home for watching. We'll see you here next time on In the Know.